In this video, we are going to be looking at the area of the thorax known as the pleura and the pleural cavities. So the aim is to address the pleura and the pleural spaces and touch on any clinical relevance of having a pleural cavity. This will help you with your learning objective to define what is meant by the visceral and parietal pleura and locate costal, diaphragmatic and mediastinal pleura. Now, what is the pleura? The pleura is the material that forms the wall of a sac that surrounds the lungs. It is constructed from simple squamous epithelial cells of mesodermal origin and is thus called the mesothelium. This tissue is also found around the heart and lining the abdominal cavity. The mesothelium secretes a serous fluid that acts to protect the organs it encloses, preventing friction and maintaining surface tension. The pleural cavity is termed a potential space within the thoracic cavity. But what does potential space mean? It's a confusing term. Essentially, it's a space where fluid fills that has the potential to expand or fill with other things other than pleural fluid, such as air, blood, pus, or lymph fluid. Now, the pleural cavity does not contain the lungs. It instead encases the lungs. There are plenty of people that get confused by this. So I'm going to create a simple model that we can use to demonstrate what we mean. So imagine this balloon is the pleural cavity. The purple border represents the pleura, the mesothelium tissue, and its pink contents represent the pleural fluid that the tissue secretes. To the left of this balloon we have a red ball. Let's pretend this is a lung. If we push the lung towards the balloon, we can see that the balloon moulds itself around the lung. But the mesothelium pleura is not broken but remains continuous as it encases the lung. And the lung is not inside the pleural cavity. The pleural cavity is the contents of the balloon, but as the lung is not inside the balloon, it is not inside the pleural cavity. On this slide, I have changed the colour of the pleura that is in contact with the lung. That is because this pleura is now termed visceral pleura, whilst the remaining pleura remains purple and is collectively termed the parietal pleura. This is the pleura that lines each pulmonary cavity. At the left of the image, the space between the lung and the external environment of the pleural cavity is where we find the root of the lung. This is where the pleura attach to each lung to create a continuous sac, allowing for the pleural fluid to be maintained at 10 to 20 mL in volume. In the learning objectives, we discussed terms like costal, diaphragmatic and mediastinal pleura. But all I've mentioned so far is visceral and parietal. So what are these other terms I casually throw around? If I move on to this slide with the image of the thorax from Grays for Students, we can see that the lungs are encased by the pleural cavity. We have already discussed the parietal pleura is the pleura that lines the cavity of the thorax. But this pleura changes its name according to its location within the thorax. So this area is labelled as the parietal pleura lining the ribs, so we call it the costal pleura. If this green area is the mediastinum, the home of the heart and the great vessels, then the pleura overlaying it is the mediastinal pleura. At the bottom, our primary breathing muscle, the diaphragm, is seen. The pleura that lies this area is therefore called the diaphragmatic pleura. What we need to remember is that our lungs do not completely fill the pulmonary cavities, but each pleura cavity does fill the pulmonary cavities. This means that there are spaces within the pulmonary cavity that the pleural cavity can hold more fluid than the tight spaces our lungs fill higher up in the thorax. These spaces are termed recesses. The recess at the bottom of the thorax between the diaphragm and the ribs is called the costodiaphragmatic recess, and there are one of these within each pulmonary cavity. What is not visible on this image is another recess, called the costomediastinal recess, between the ribs and the heart. As mentioned briefly, the lungs and the pleural cavity are not entirely flush. the pleural cavity extending inferiorly beyond the inferior border of the lungs. We can see this far more clearly on this surface projection from Grays for students. Be prepared to pause the video and test your ability to recall the anatomy. These arrows are pointing to the lungs. What area of the lungs are they pointing to? These are the superior lobes. What is the line that borders the inferior border of the right superior lobe? This is the horizontal fissure. Beneath the horizontal fissure, we have the middle lobe. And what are these two arrows pointing to? These are the inferior lobes. When looking at the thorax and considering important landmarks, we often look for these three ribs. What numbers are they? They are ribs 6, 8 and 10. Use your knowledge from the previous slide to name this pleura. It lines the diaphragm, and thus this is the diaphragmatic pleura. In which case, what is this space called? This is the costodiaphragmatic recess. I've mentioned another recess in this video. Recall that name for this label. This is the costomediastinal recess. Here are all of the labels. You can screenshot this image for your notes. If we look at the posterior aspect, the labels have already been added. Posteriorly, we can see the inferior border of the lungs extends to rib 10, but the pleural cavity extends to rib 12. As a side note, you'll also see that the middle lobe of the right lung is not projecting onto the posterior chest wall. The oblique fissures travel in the direction of the fifth intercostal space, which is a useful border for identifying superior and inferior lobe boundaries. To summarise, the learning objective covered today will help you describe the terms visceral and parietal pleura, including the names costal, diaphragmatic and mediastinal pleura. Visceral pleura surrounds the lungs, and parietal pleura lines the pulmonary cavity. The mesothelial tissue produces pleural fluid, which prevents friction and increases surface tension. Each lung is isolated by each of the pleural cavities, and the parietal pleura is named according to its location. Diaphragmatic lines the diaphragm, the mediastinal lines the mediastinum, and the costal pleura lines the ribs. There are three recesses, two costodiaphragmatic recesses, and a single costomediastinal recess. If you look at the next video, you will see clinical implications of the pleural cavity, including a couple of case studies that relate to pleural effusions and pneumothorax.